Okay, folks, we're gonna move on to our notes. We got to finish the notes. Let's see. Yeah. Okay, great. Any last finishes? Okay, so we have Sydney. Okay, anybody else? Last call, Logan. Oh, what's the question?
I completed like the first half of the Is that
No, it doesn't count. Yeah. All right, we're gonna jump into movement. Finish up hopefully at least one PowerPoint today.
not fast enough? So you're like I started shifting. On the path that
Okay, and yeah, we are recording this for Matt and Jake since they're not here. Your test, your Unit 2 test has been scheduled from a week from today, Thursday. And so hopefully we can finish all the PowerPoints today. And then, yeah, and then we're just reviewing next week until next week, Thursday. Okay, that's the game plan. But we'll see how far we get. We'll probably have to wrap up a few things on Monday. All right, so we're finishing off. We have already taken a look at the bones, muscles, purposes of the bones. This next PowerPoint is on the joints primarily. Okay, what kind of joints are there? What are the different classifications of joints? And what are the different joints? And you probably have seen a lot of these already on the GIM kit. And so we'll move through that quickly. And then if we have time, we'll jump into the last PowerPoint, which is just muscle functions. Okay, how does the muscles work? But let me pray for us, and then we'll jump in. Father, thank you so much for this day. Thank you for my students. Thank you for their efforts to soak up as much as they possibly can. And I pray that as we learn about the joints and the functions of muscles today, how the muscles work at the microscopic level, you would help us to understand and better take care of our bodies and better able to understand the terminologies that people use professionally in physical therapy and as doctors use them and nurses use them. So thank you so much for this time. Please help me to teach. Help us to learn from one another. We pray this in Jesus' name. Amen. Okay, so here we go. Movement. We already talked about joints. Joints are any places of contact between two different bones. And there are a whole bunch of different joints in your body. We have ligaments and tendons. Ligaments, a lot of times a joint contains both of them, both ligaments and joints. The difference, ligaments connect bone to bone, and tendons connect bone to muscle. So we already took a look at that. So there are two different ways to classify bones and not bones and muscles, joints. One of them is what they do, their functional classification, and then what they look like, structural classification. Okay, and this is on page. Did you guys find it yet? 30, page 30. Okay, yeah, page 30. 33. Okay, yeah, so this is on page 33. It is already written down for you. So just kind of take note of it, highlight it, try to put it into your brain somehow. So these are the functional classifications. This is based upon how movable they are. Okay, the functional classification is how movable they are. So we have three types. We have, can you guys say synarthroses? Okay, synarthroses. And what word do you see in arthros, or what disease do you see in arthroses? Okay, arthritis, right? Arthritis is when your joints become very stiff, either because there's not enough cartilage or there's not enough collagen, or they start to curl like this. So you have arthrosis. Not arthrosis, arthritis. So we have synarthrosis. Synarthrosis or synarthroses, plural, are joints that don't move at all. Okay, so for example, on your skull, there's a joint that holds all of your bones together. Right, we talked about we have the frontal bone, occipital bone, parietal bone, temporal bones on the side. there are suture bones or joints in your head, and they are not supposed to move. That'd be a bad thing if they started moving, and your brain would start leaking out. So those are synarthroses. Okay, joints that don't move at all. Next, you have amphiarthroses. Okay, amphi is kind of like this word, like amphibian. What is an amphibian? Okay, they can live they can live in the wet and on the dry, right? They can live in the water, they can live on land. So these are like kind of in between. Slightly moving, sometimes they move, but most of the time they don't move. Okay, so this is one really good example of this is the pubic bone or pubic joint. There's a joint right here. Okay, this pubic joint shouldn't move very much. It shouldn't move very much. However, if you are giving birth, this thing, the female body releases hormones to relax this amphiarthrosis joint, and it relaxes a little bit to give more space for the baby to come out. Okay? That is the only time where this thing starts to move a little bit. Does that make sense? Amphiarthrosis. And the last one, diarthrosis. Most of the joints would fall under this category. Diarthroses are freely moving joints. So your shoulder, your elbow, your knee, those would all be diarthroses. Okay. Questions on that? Okay, moving on along. The other way is by structural classification. There's also three. So a lot of people get these mixed up. So keep them straight. There's three functional, how movable they are, and these are three based upon what they look like, structural. All right. So the next three, we have five, and it's kind of parallel. Fibrous joints. Fibrous joints are made out of collagen fibers. That's why it's called fibrous joints. These joints, again, don't move at all. Okay, so the sutures in your head, they would be considered fibrous joints based upon what they look like. They're made out of fibers that don't move at all. But functionally, they don't move at all, so they would be considered synarthroses. Does that make sense? So based upon either what it does or what structure, we have the same joint, but it's classified as two different things. Okay, so that's fibrous joints. Some other ones that we have, not as important, but I think they might be on the GIM kit. Your teeth, right? They don't move very much unless, except for your baby teeth, I guess. Those are specific fibrous joints. So they're technically called gum fosses. Your fibula and tibia have a joint there. They have collagen fibers that hold that together. That's called a syndesmosis. And then your bones specifically are called sutures in your head. Okay, but for the test, you need to know them as fibrous joints. But just know that specifically, there's specific names for some of those fibrous joints. Okay, fibrous joints don't move. Made out of collagen fibers. Okay, the next one is cartilaginous joints because they're made out of cartilage. Okay, these guys are kind of like amphiarthroses. Okay, amphiarthroses. They sometimes move a little bit, but they shouldn't be moving too much. Okay, your ribs, right? Cartilage, made out of cartilage. They're connected via cartilage. Also, the discs in your spine. Okay, they shouldn't move very much. If they do move, sometimes you get a slip disc or a herniated disc when it kind of bubbles out and it causes a lot of pain. Okay, so those would be considered cartilaginous joints based upon what they look like. Based upon what they do, they would be more like an amphiarthroses. Okay, last one. Okay, we have these things called synovial joints. Synovial joints, they do have some cartilage, but they do move a lot. Okay, these are all the other joints, synovial joints. This is the most diverse amount of joints. Most joints fall under this category. So if you're on the test and you have no idea, you should guess synovial joint because chances are most of the joints fall under this category. It's the most mobile. It's called synovial because there's a fluid cavity. There's a hole in the joint that has fluid inside of it. These are the joints that you can crack. Okay, they make a little cracking noise. Although actually you can crack your back. So yeah, a lot of your joints you can crack because there's some fluid inside of there, so some gas bubbles. Turn to your neighbor, see if you can review those 6 different types of joints. based upon functional and structural classification. Okay, go.
They're all the same.
Amphiarthrosis.
I say it takes because I came
Okay, finish up in 5, 4, 3, 2, and 1. Moving on along. Just some review material as we move on. Notice that in this synovial joint, there's the end of the bone called the epiphysis, kind of over that last class. And there's spongy bone. The spongy bone contains what kind of bone marrow? Good, red bone marrow. Red bone marrow does what? Okay, makes red blood cells. Good. We also have, notice in the very center, there's another cavity. There's another hole called the medullary cavity. That was dumb. And the medullary cavity is filled with the other type of bone marrow, yellow, and that stores fat. Very good. So here's a picture of a synovial cavity. And so here, notice that on the very outside, you have ligaments. This white part is a ligament. And then on the inside, we have this hole, and that's where there's a lot of fluid. That synovial fluid is there to lubricate the joint. So if that starts to decrease, which it does in your older years, you start getting arthritis, you start getting pain in your joints, and all that good stuff. Yeah. Okay, synovial joints. Okay, the main thing you gotta know about synovial joints is they have fluid inside of them. Okay, they have a whole bunch of other stuff, but that's kind of the main thing. Synovial fluid, but yeah, they have all the things of the joints. Okay, there are 6 main types of synovial joints. Okay, all of your joints can fall into one of these categories. Again, this is based upon what it looks like, not what it does. So what's a little bit confusing is some joints, like your elbow, actually fall into 2 of these categories. Okay, but we'll get there. All right, this is on page 35. Okay, there are 6 different joints, and like I have like the scientific names on them on here. You can scratch that out and put their common name. Okay. All right, so here's the first one. Top right corner, we have what we call the plane joint or the gliding joint. Okay, the plane joint or the gliding joint. It allows gliding movements. Okay, so the best example, I know your paper says that it's the joint between your clavicle and your scapula, the acromion of the scapula. Okay, a better one are the ankles and wrists. Okay, ankles and wrists are gliding joints. Okay, they glide in either the x-axis plane, okay, and they can kind of wobble like this. Okay, gliding joint. Okay, next one, hinge joint. Okay, hinge joint because it kind of looks like a door hinge. Yeah, like a door hinge. Your elbow and your knee, right? Those are really good examples of hinge joints. Also, your fingers. Okay, your fingers, not the knuckle of your finger, but the phalanges of your finger, right? They only close like a door hinge. Okay, your knuckle is actually something else. Okay, your knuckle is something else, but these are all hinge movements. And as we go through them, we're also going to go through some of the body movements they allow. Okay, so, and this is super practical for physical therapy. A lot of physical therapists will use these kind of body movements to describe what they want you to do, or some of the movements that some of the exercises that they do. So here's the first one. Hinge joints allow flexion and extension. Okay, what does flexion mean? Flexion means bending the joint such that the angle gets smaller, the angle between the two bones, right? So if the angle is decreasing, that's flexion. The way I like to think of it is whenever you're flexing the muscle. A lot of times when you're flexing the muscle, then that's flexion, right? Flexing the bicep. Okay, this is flexion. Okay, flexion. Flexion of you're flexing your hamstring, that's flexion. But the official definition is when you're decreasing that angle. Good? Okay, extension is the opposite. You are increasing the angle. Okay, increasing the angle. And then of course you also have hyperextension, which is like usually you're injuring yourself, okay, or you're super flexible. Okay, you're extending even beyond what it's supposed to. Okay, so hyperextending your back or your leg. Okay. All right, so let's pause there. That's a lot of stuff already. So we have gliding joints. What are examples of that? Hinge joints. What are examples of that? And then difference between flexion, extension, hyperextension. Go do that with your neighbor. Go. 2 minutes.
Gliding allows them to glide. Yeah. And then the other one is your finger. And it allows
Hinge joints.
Yeah. Okay, about 30 seconds. Yeah. Which that should be really easy, right? As long as you know extension, hyperextension is just even more so, yeah.
What is
What?
Is there like an extension
For what?
or
Just gliding motion. Okay, finish up in 5, 4, 3, 2, and 1. Okay, the next joint, again, like a lot of these motions might seem similar, but again, these joints are classified upon what they look like. All right. So pivot joint, we just said, right, your elbow is a hinge joint primarily. Okay. But notice your elbow can also do this, right, to turn the doorknob. Okay. So this pivot joint looks kind of almost like a doorknob, and it can turn in like a 360 kind of rotation movement. So this joint, particularly right in between your ulna and your humerus, okay, that would actually be a pivot joint. So your elbow has primarily a hinge joint, but it also right here has the ability to do this, which is a pivot joint. Does that kind of make sense? Okay, pivot joint. Pivot joint allows you to do another motion called, and again, it makes sense. I know the Gimkit, you were asking about this the other day. Like, why does the Gimkit say turn forward? Okay, it's because in anatomical position, okay, when you do this, you turn your palms forward to be in anatomical position. That is supination. So do this with me, supination. Okay, soup, because you're making soup. This is supination. And pronation is opposite. Okay? Supination, pronation. Okay? Supination is when you turn your palms forward. Pronation is when you turn backward, when you're in anatomical position. Okay? Yeah. Need to know what? Yeah, so I might say, what is the body movement when you turn your palms upward? Or if you turn your palms forward if you're in anatomical position. Pronation is when you empty your bowl. Pronation. No, or you turn it backward. Okay. Yeah. Okay, I'll do another one. Condylar joints. Okay. Condylar joints are very similar to the pivot joint as well, but it looks different, right? Your pivot joint looks like this. It looks like a doorknob. Your condylar joint almost looks like the next one, or actually two other joints, which is called the ball and socket. Almost like it looks like a mini ball and socket, but it's not completely a ball and socket. It's like a wannabe ball and socket. Okay, condylar joints. Okay, they describe it as a pedestal with a joint on top. So it's like a stick with something on top of it. Okay. So condylar joints. What are your condylar joints? Your condylar joints would be this knuckle. Okay, your knuckles. Okay, notice it can kind of rotate. It can go up and down. It can go this way. Okay, condylar joints. Also, your wrists. Sorry, your wrists are primarily condylar joints. Right? It can be gliding, but part of it is also a condylar joint. So it depends on the movement. Okay, condylar joint. The wrist is primarily condylar, but it can also do gliding motion. Okay, abduction, adduction. Okay, what does it mean to abduct somebody? Take them, kidnap them, right? Steal them, right? So abduction is when you're moving the limb or the bone away. So like if I'm doing it for my arms, this is the best example. Abduction would be to move that away, steal your arm away. Abduction. Adduction, kind of like your adductors in your groin, your groin muscles. Adductors move it towards the medial plane. Okay, so your groin muscles are called adductors because I want you to do this. Okay, try to squeeze your legs together this way. Okay, right? You can feel your groin muscles working, right? They're called adductors because they adduct your legs. Okay, so I don't know. You gotta be able to remember the difference somehow. You can remember that your groin muscles are adductors and they keep your legs together, or abduction and adduction's the opposite of that. Okay. All right, we'll pause there. So we have pivot joint, supination, pronation. What is an example of pivot joint? Condylar joint. What is the difference between abduction, adduction? Try that with your neighbor. Go. 2 minutes.
Supination, pronation. It's twisting. I don't want to be someone smart. I feel ashamed. I think we want to present yeah, but you're with someone. So I don't want to be like Kylie or something. Like I'm
Okay, finish up in 5, 4, 3, 2, and 1. Okay, moving on. Your thumb has its own category. Okay, because your thumb is different from all of your other fingers. It can oppose it. It can touch all your other fingers. Can't really. Well, I guess they can, but your thumb can oppose your other fingers. It is almost like a person sitting on a horse saddle. So your thumb is the person, and it's sitting on a saddle, which is kind of nice. So it can kind of do this. It's also kind of like a condylar joint, but we're gonna say that the thumb is primarily a saddle joint. Okay, allows opposition. It opposes your other fingers. Okay, saddle joint. Okay, and then lastly, the most famous of all, and the most mobile, and the most mobile is your ball and socket joint, and it's called that because it looks like a ball in a socket. Okay, your shoulder is a ball and socket, and your hip is a ball and socket. Okay, your shoulder and your hip. Those have the most mobility out of all the synovial joints. Okay, so ball and socket and our saddle joint. Okay, so ball and socket allows you to rotate that joint. Okay, you can do your arm circles, rotation. Okay, what other movements did we miss? Rotation. Okay. Another name for rotation is circumduction. Circumduction is the same thing as rotation. Okay, moving it in a circle. Okay. Elevation. Okay, elevation is when you raise it towards your head, more superior, right? So you elevate your arms, elevate your legs, right? When you sprain your ankle, elevate, you bring it closer to your head. So that's pretty, depression is the opposite. So that's pretty self-explanatory. Protraction, retraction. This only applies really to your jaw. Okay. Protraction is like an underbite. Okay. Retraction is when you bring it back out, bring it back in. Okay. Underbite is protraction. Okay. All right. What else? Turn to the next page. Two more. Okay. These ones are the hard ones. So your ankle is a little bit different than your wrists. Okay. Your ankle is a little bit different from your wrist. All right. Your ankle actually has two flexions. Okay, two flexions. So it's a little bit confusing. The first one is dorsiflexion. Okay, so point your toe up. Okay, point your toe up. That's dorsiflexion when you're stretching your calf muscle. Okay, stretching your calf muscle, dorsiflexion. When you point your toe down, like when you're tippy toeing, that is plantar flexion. Have you guys heard of plantar fasciitis? Yeah, it's very common. Yeah, so you have it, Dylan? What happens? What does it feel like? Can you describe that for us?
Like the pain in your arch and you can't even walk. It just hurts to walk, and especially.
Okay, good. Yeah, so it's painful when you put pressure on it, right? And the reason is on the bottom of your foot, you have what we call plantar. Okay, this is your plantar region. We didn't cover that, but it's your plantar region. And you have this thing called muscle fascia. Okay, actually all over your body. But for some reason in your bottom of your foot, when that fascia gets inflamed, okay, you get fasciitis, okay, plantar fasciitis. Okay, any kind of itis is inflammation, by the way. Okay, bronchitis, fasciitis, laryngitis, hepatitis, all inflammation of whatever it is. Okay, but plantar fasciitis, okay, so plantar flexion is when you're flexing your plantar region. Does that make sense? The bottom of your foot, right? So when you flex the bottom of your foot, you're pointing it towards you. That's how I remember plantar flexion. Okay, dorsiflexion. Another way you can remember it, I've heard it, is like you're pointing it towards your back. Although technically, like I feel like plantar flexion is also pointing to your back, but dorsiflexion pointing it toward your back, and plantar flexion is when you're flexing your plantar region. Okay, does that kind of make sense? You got to find a way for you yourself to memorize it. Okay, so turn to your neighbor, see if you can go over these body movements with them. What are those body movements? And just go over all of them, starting from flexion all the way down to. Oh wait, I forgot one more. Inversion, eversion, easy. Okay, when you tilt your foot inwards like this, inversion. When you tilt it outward, eversion. Inversion, eversion. Okay. Yeah. So tilt your foot like this. Inversion like that. Inversion. Okay. All right. Eversion. Okay. Turn to your neighbor. 2 minutes. Go.
Circumduction is extension. Yes. Elevation is Okay. So this is
Okay, finish up in 5, 4, 3, 2, and 1. Okay, the last couple things. This is not on your test, but I would like to go over them. I think it's on the GIM kit, and we'll cover it more second and third quarter. there are two different kinds of contractions when you contract your muscle or flex your muscle. There's what we call, and some of you guys already might know this from just workouts. There's what we call isotonic contractions, in which there's a, remember that iso means same, and so we'll go with isometric first. That's the easier one. Isometric means that the length of your muscle doesn't change, or in other words, you're exercising but you're not moving. So like planks, right? You're holding that, your muscles are not lengthening or shortening. That would be an isometric contraction. When you're doing chairs, right? If you're doing a chair, isometric contraction. A lot of like core and like lower body workouts are more isometric. On the other hand, we have isotonic. Isotonic means that the force stays the same, but your muscle is lengthening and shortening. Okay, isotonic means the force is the same. Isometric means the length stays the same. That kind of makes sense. Okay, so yeah, bicep curls, push-ups, pull-ups, those are all isotonic contractions. And then lastly, we have, you might have seen this on the gym kit, insertions and origins. What is the difference between that? And just jot it down for now. It's not on the test, but it'll be important when we start doing muscles on the mannequin. The origin of the muscle, remember that muscles usually connect to two bones, right? Muscles always connect to two bones, and muscles always pull, they never push. If you're pushing something, you're actually, there's a muscle that's pulling the bone so that you're doing that motion. Your muscles always pull. So there's two bones that it always has to connect to. The origin of the muscle is the end of the muscle that connects to the bone that doesn't move. And I'll explain what that means in just a second. Okay, but the origin is like where the muscle originates. So that part of the muscle, that part of the bone doesn't move. That bone doesn't move. The insertion is the other end of the muscle that actually does move. The bone that actually does move. Okay, so we'll do bicep. Bicep is a really good example. Your bicep brachii connects to your all the way up here. Okay, there's a tendon that connects all the way to your scapula. Okay, and then the other end connects all the way to your humerus. Okay, now look at what's moving. Is your scapula moving or your radius moving? Okay, your radius is moving up and down. So your radius would be the insertion. The scapula end of your bicep would be the origin. Does that make sense? Okay, every single bone has an origin and insertion. And when I took anatomy, we had to memorize all of the different muscles, but also their origin and insertion, which is a big pain in the butt. That's not going to be on this test. We'll learn more about that second quarter. Okay? All right. As we move on to the next PowerPoint, review everything from this PowerPoint, starting with 3 and 3. What are the structural functional classifications of joints? What are the 6 synovial joints? And what are the body movements? Okay, see if you can remember that. Go.
Moving away, moving forward. Which is like and then circumvention. Oh, there's a function of
Okay, finish up in 5, 4, 3, 2, and 1. All right, we have made it to our third and final PowerPoint for Unit 2, which is going to cover the physiology of muscles. Like how do muscles work? What are the microscopic parts? We're going to start big and then zoom in to be small, just like the bone. Okay, so here we go. What is the overall functions of the muscle? The overall function of the muscular system is to help you move. That is the main function. Okay, so yeah, you might want to jot this down on page 37. Okay, page 37. Okay, the main function is to move, but there are some other functions that you should just be aware of. Jot them down. Your muscles help to maintain your posture. So your muscles are working even now as you're sitting there. Okay, they help you to maintain your body position. Okay, so even when you're not moving, right, which is main function, it's also continuing to help you maintain posture, stabilize joints, and if you are cold, you will start to shiver. That generates heat. Whenever you flex your muscles or use your muscles, it generates heat as a byproduct. Okay, the generation of ATP is exothermic. For those of you in AP Chem, remember back to the good old chem days. Okay. Yeah, I mean, we already did insertion origin. This is a continuation of that. Okay. And then, yeah, we're going to go over this more second quarter, but muscles always pull. You can think of muscles and tendons kind of like rubber bands. They always pull things. Muscles never push. Although you can do a pushing motion, though when you do a pushing motion, there's muscles that are pulling to help you to do that motion. Okay, but they always pull. All right, moving on. There are 3 different types of muscles. Okay, 3 different, just like there's 3 different types of bones, 3 different kinds of joints. Okay, actually, sorry, there's 4 different types of bones, 3 different kinds of joints, functionally and functionally and structurally, 3 different types of muscles. The first one is what we call a prime mover. Okay, prime, just like Optimus Prime. Prime means the greatest or the number one. Okay, prime. So this is the main muscle responsible for a movement. So when you're doing a dumbbell dumbbell curl, what is the main muscle that you're using? Biceps brachii. Okay, that is the prime mover, also known as an agonist. Okay, I think on the test I don't really use agonist, but it'll make more sense when we have the antagonist. But prime mover. Okay, biceps brachii is the prime mover in forearm flexion. Okay, we also have the second type of muscle is a synergist. What does synergy mean? Like when you're in a group? Yeah, 2 dogs or horses that are pulling together. They can actually pull more weight than if they were to each do it individually. Okay, that's what synergy is. Synergy is you can accomplish more together than if you're to do it independently by yourself. Okay, so synergist muscles are muscles that help the prime mover. Okay, so in terms of the biceps brachii, there are a whole bunch of other muscles you might have seen in Poca muscle, also in the arm. You have the brachialis. Okay, the brachialis, which is what we will be modeling on your mannequins, that is a synergist of the biceps brachii. It helps out the biceps brachii. It's not the main muscle, but it helps that movement. Oh, here's that oomph, Jake. Okay. It helps us stabilize the joint. It adds some oomph to it. Okay, synergist. Okay, there are specific types of synergists, but again, not super important. Okay, synergist. Okay, the last one. Oh yeah, here, brachioradialis, brachialis. Okay, those are all synergists to the biceps brachii. Okay, and then lastly, we have muscles that oppose the prime mover. They do the opposite. They pull in the opposite direction as the prime mover. these guys would be antagonists, which makes sense, right? In English, what is an antagonist? Okay, yeah, the villain, the enemy, the bad guy. Okay, antagonist are the muscles that oppose the prime mover to do the opposite. So bicep curl, what is the antagonist? Triceps brachii, okay, is the antagonist. Okay, just for this movement, the bicep curl. If you're doing an overhead, what is this kind of exercise? Tricep, I don't know. Yeah, when you're doing working your triceps are the prime mover, and then your biceps brachii are the antagonists. Okay, so it all depends upon, it's relative to the movement that you're doing. The Japanese press. Okay, so triceps brachii, antagonists in forearm flexion. Okay, antagonists. So yeah, you can just label that picture right there. Triceps is antagonist, biceps is the prime mover, and then in between, not pictured in the picture, you have some muscles that help it out called the synergists. Okay? All right, review that with your neighbor. 3 different types of muscles, go.
Or not contributing, but they're like additionally helping
Okay, finish up in 5, 4, 3, 2, and 1. Okay, I want you to rewind in your head back to unit 1 because we already covered the next slide. I want you to rewind. What are the 4 different types of tissues in the body? You guys remember? Connective tissue, cardiac. Oh, wait. Cardiac, skeletal, and smooth fall under muscle tissue. Yeah, muscle tissue. What are the other 2? Okay, we already said connective, muscle, epithelial, and nervous. Good, nervous. Okay, those are the 4. All right, so since we're on specific muscles, you got to know the 3 different types of muscle tissue. We already went over this, though. So this should be review. We have cardiac, found in your heart. Is it striated or non-striated? Is it striped? It is striped. Oh, wait. Yeah, it is striped. It is striated. It is striped. Okay, this is kind of what it looks like. I know that the picture is kind of junk. Okay, it is striated just like skeletal. Skeletal and cardiac are the same in striated. But is it voluntary or involuntary? Involuntary. Okay, smooth muscle and cardiac are both involuntary. You cannot consciously control it. Where are smooth muscles found? Anyone remember? In your intestines. Yep. Any tubing in your body. Digestive system, your blood vessels, your iris in your eye. Okay, those are all smooth muscle, and it looks smooth because there's no stripes striated. And then skeletal muscles is found in your skeleton, or it's connected to your skeleton. It's striated, and you can consciously control these muscles. Okay. Yeah. So you should already have this chart down somewhere, right? You guys have that? Okay. Should be in unit 1. So make a little asterisk. Muscle tissue types. Look back at page 23 or something like that. Okay. All right. Okay. When it comes to organization, okay, each muscle is considered an organ. Your bicep is an organ. That's at the organ level. So all your muscles combined would make up the muscular system. Okay, but each muscle itself would be the organ. Okay, and we're gonna go deeper in just a minute. Each muscle has muscle tissue along with nervous tissue, connective tissue, all this kind of tissue, and then even smaller, there are muscle cells. Okay, we're gonna get to that. We're gonna go from big to small. We're gonna go from a zoomed out picture, bird's eye picture, and then zoom into the small. So there's this picture already labeled for you on the bottom of page 37. All right, so starting off, I'm going to start big to small. Okay, at the biggest organ level, you have the muscle. Okay, and it is covered by a certain connective tissue. It is clear. It would be considered part of the muscle fascia. And I wish we could dissect like a cat or something so you could see all the fascia. I don't know if you remember like the fetal pig. The fetal pig doesn't have very much of this because it's not developed. Its muscles aren't developed. But does any of you guys remember this like kind of? Oh, actually, if you ever cook and you cook chicken or beef, and there's this kind of like white spider webby kind of material that's in between the in between the meat parts, right? That is muscle fascia. That's this thing called epimysium. Okay, it covers the muscle. It kind of lubricates it. It protects it from infection. Okay, it's just a covering though. Okay, epimysium. There's a bunch of mysiums. They're all covering. Okay, so the first one is epimysium covers the muscle. All right, muscles. Yeah, you can think of if you were to chop a muscle in half, right? You would see that there's all these parts inside of it. You could actually like take one out. These muscles are like long strings. It's almost like that big container of red ropes or red vines, right, at Costco or Longs. That's kind of what your muscle looks like if you were to zoom in. So if you take out one of those red vines, it is called a muscle fascicle. Okay, so the muscle is made out of muscle fascicles, right? Let's see, and then going backwards, okay. Your muscle fascicle, if we're to take out one of those strands, we would have what we call a muscle fiber. Okay, jot this down next to muscle fiber. Muscle fibers, oh, it's not highlighted on your paper. Muscle fibers are the muscle cells in the muscle. Okay, at that level, that's the muscle cell. Your muscle fibers are the muscle cells. Okay, muscle cells. But we can go even deeper. If we take out one of the strands of your muscle fiber, we get what we call a myofibril. Can you guys say myofibril? Okay, myofibril. Okay, that's even smaller. Okay, it's almost like chromosome, right, to chromatin, to DNA. Same thing, except this is for your muscle. We can unwind it strand by strand. Okay, myofibril. Your myofibril, okay, your myofibril is technically an organelle. Write that down. Okay, your myofibril are organelles, right? Because muscle fibers are the muscle cell. Inside the muscle fiber, they're filled with these things called myofibrils, which are organelles that are basically how your muscle moves. They're the basic units. Okay, myofibrils. Your myofibril, though, if we take that apart, there's two more filaments. There's what we call actin and myosin filament. You might have seen that in a game kit. Okay, actin and myosin filaments, and we'll get to that in just. We'll probably get to that on Monday. Okay, but just like how we're talking about how genes, right? Genes are a section of the DNA, right? You have a whole bunch of these genes next to each other. Muscles have something similar. We call them sarcomeres. Okay, a sarcomere is one individual section of the muscle. That is the most basic unit of the muscle. Okay, sarcomere. So you have sarcomere here, sarcomere here, sarcomere here. Okay, you have a whole bunch of sarcomeres. Those are the individual units of the muscle. And we'll zoom into that shortly. Okay, one more thing to add to your paper. That's not on. Oh, actually, it is on there. Yeah, it is on the bottom. I didn't see it. Okay, so notice, right? Muscle fascia. You have this epimysium covering the muscle. You have perimysium covering the fascicle. And then you have endomysium covering the muscle fiber. 3 different coverings for each of the 3 different structural units of the muscle. Okay, endo means inside. This is the most inner covering, and it's on the muscle cells, on the muscle fibers. On the next level, you have peri, which actually peri means outside, like a periscope of a submarine. And on the very edge, you have just like epithelial. It's kind of like on the outside, you have epimysium. Okay, yeah, but it's already on your paper. Just circle it so that you don't forget. Okay, turn to your neighbor. See if you can label these different parts of the muscle, and this is probably where we will end for today. The important part is you have to know the order. You have to know the order. You have to know at what level is the muscle cell, muscle organ, and an organelle. Okay? Try that with your neighbor. Go. 2 minutes.
Wouldn't you be going from right to so you would have that your myofibril, and then outside of that you have the muscle, or outside of that you have the muscle fibers, and outside of that you have
Okay, once you're done, see if you can remember everything about muscles and joints that we covered today. Just run through it as you guys pack up. All right, we'll be done.